Now, male enhancement is a taboo topic for some, but the more we talk about it and normalize the subject, the less taboo it becomes. Just like how Botox used to be fairly taboo, now no one raises an eyebrow. Today, we're going to be talking about a special topic, male enhancement. This video is going to just brush the surface of what's available out there, from surgical to non-surgical options. If you would like to watch a video that answers the most commonly asked questions, please click on the top right corner here. Let's get started. So what is male enhancement? There are several reasons why men may want to consider male enhancement. Some of it can just be due to the aging process. With aging, the caliber of blood flow going into the penis starts to diminish with time and age, and therefore the girth, the length, the firmness of erection, the duration of erection, they may all be going a little bit downhill. Others may just be wanting to go a little bit fuller or longer, or just say that they've never really had strong quality erections and they just want to see if they can give that a little boost. So these are some of the reasons why men may consider doing male enhancement procedures. The different options that we have here at Integrated Aesthetics ranges from the non-surgical to the surgical. Dermal fillers are one of the most common ways to increase the girth of the penis. The more we add, the more girth we can add as well. Typically, the dermal fillers, like the ones that we use in the face, are the ones that we use for the penis as well. There are different characteristics of the fillers that we may be using depending on the firmness that we're wanting and the quantity that we're using as well. Some of the other non-surgical options include our P-shot, which is where we're drawing blood out, spinning it down, and adding it into the penile shaft to increase the blood flow. That can help with symptoms of erectile dysfunction. It can also, over time, add more blood flow and hence add a little bit of girth and maybe even just a little hint of length. In terms of other options, you may have heard of terms like scrotox, and that's where you're actually using Botox to inject into the scrotal skin. It helps to relax it, gives a little bit of a smoother appearance, and may give a little more scrotal show because it's not as constricted in its form. And the same way that that works, you can also inject Botox into the shaft to also improve blood flow and erection quality as well. Who knew? Another interesting way to add blood flow to the penis is our acoustic shock wave technology. The one we have here is called the Z-wave. And what it does is it causes little micro injury into the penile shaft. As the penis is healing from these little micro injury, more blood flow is created. Oftentimes we combine this with our P-shot procedure because that's another way to stimulate increased blood flow. So the combination of the two really tries to increase and enhance both the quality of the erection, the duration of the erection, and the amount of blood flow flowing into the penis, which again may give you a little hint of girth or possibly even length. On the surgical side, we offer surgical ligament release, which helps to release the penile ligament, which is attaching the penis to the bone. And that ligament is responsible for the directionality of the penis with an erection. So if your penis is normally pointing upwards or forward, after ligament release, it's going to be pointing a little bit more downwards. It doesn't impact the functionality of the penis, but because the ligament is no longer tethering the penis in the body, the penis can protrude forward a little bit, and that's where you may gain somewhere in the order of maybe 1/4 inch, 1/2 inch, maybe even 3/4 of an inch or more, depending on how strongly tethered that ligament was holding the penis on the inside. In addition to this, what we can also do is fat grafting to the penis. Fat grafting is the analogous treatment that we use for fillers, and the goal with fat grafting is to enhance the girth of the penis, and we can borrow fat from one part of the body and inject it into the penile shaft. A common location for the fat graft donor site is the mons area, especially in someone who has a fairly full mons. Just debulking this may also start to unmask the penile shaft a little bit as well, giving the illusion of a little bit more length to the penis. So if the mons is not really an issue, then the abdomen is a very common next location that we might be borrowing fat from. The combination of reducing volume and adding it back into the penis gives a little more contrast, which can also help with the overall aesthetic goals. Another technology that we have is our Emsella chair, which uses pulse electromagnetic fields to cause very strong contractions of the pelvic floor muscle. This strengthening of the muscle also increases the blood flow through the muscles, which then transmits to firmer erections as well, because the blood flow through the pelvic floor muscles lead to the penis. The Emsella chair can also enhance sensation during orgasm because our pelvic floor muscles are what contract during ejaculation. So with a stronger pelvic floor muscle, it can help enhance the enjoyment with sexual activity. So when you come in for a consultation, we're going to be able to listen to what your concerns are, do a physical exam, make an assessment of what options there are for you, discuss some of the pros and cons of the different options, the downtime requirements, activity restrictions that you may have, and come up with the best options for you. Oftentimes, using more than one modality may help you to get an even stronger result. At Integrated Aesthetics, we take a more comprehensive approach to your male enhancement goals. So this topic is a concern for many men out there, and I hope this video helps to give you an introduction to some of the different options that we offer here at Integrated Aesthetics. So don't forget, if you would like a more in-depth video on some of the different options we have and some of the commonly asked questions associated with male enhancements, such as, will gaining or losing weight affect my results if I've had fat grafting? How much downtime there's going to be? What are the risks or complications associated with some of the different procedures? Click on the top right button to watch an additional video. If you enjoyed this video, don't forget to give us a thumbs up. Click on the bell icon for more notifications for future videos, and subscribe to our channel. I look forward to seeing you the next time.